really excited to share some information with you tonight. I hope it makes a huge difference for you and for your family and loved ones. And I have to tell you, it's been a long time since I've done a webinar. I've been waiting a long time to do this webinar, and there's a few reasons for it. One of the reasons is, look at all this information. I mean, this is just the tip of the iceberg here. I wanted to make sure I had something somewhat complete for you that I could share that would make sense and that was usable and that I could kind of teach in a way that made sense. And also, this is pretty new. So, one of the common questions I get when I get a referral for long COVID is like, well, what's your success rate with long COVID? There are stories out there, okay, but this is a pretty new thing. And you're going to see that when you look at this picture, for example, a lot of people are in some pretty deep waters here. And it's going to take some time to untie this knot for them. And I'm up for the task. And very excited to share this information with you. Some of these cases are work in progress. And also, this information is subject to change. I have to tell you, I read papers every day. Some of them completely change how I approach this stuff. And there's breakthroughs, there's new things that come out. And so this webinar might be antiquated in a matter of months. I don't know, but I'm totally open to that. I'm not married to these ideas as the only thing that's going on. Anybody that tells you they know everything about COVID-19, just run from that person. I mean, listen to them, but run. Seriously, nobody knows everything about this stuff. It's incredibly complicated. If you can remember back when this started, the question was, is this just another cold? Like the cold? And some people are still saying it's kind of like the cold. Some people are saying this is just another flu virus. What if it was? What if it is another flu virus? Think of what the flu did when it first came out. Okay? And think of what it's doing now, still every single year. Now, there are a lot of people that didn't make it from the flu, and there's a lot of people that aren't going to make it from COVID. I don't want to be insensitive to those individuals, okay, and the families that are dealing with that loss. So we can just take a moment to acknowledge that, okay? But for the rest of us that are here, okay, I want you to know that it's pretty serious what's happening with this virus, and the information that I have to share is it's a bit sobering, but I'm going to, at the end, or at least during parts of this, I'm going to try to make it positive, okay? Because with all of this information comes a particular way of organizing things that gives us a approach that can be applied to you and your family, and I think can make a big difference. So just hang in there with me. If it sounds like I'm going off the deep end on this overwhelming bit of data, remember that slide I just showed you with all those factors involved with long COVID? I'm trying to make that condensed into a story that I can share with you. One particular type of case that I run into, okay, is somebody that has reached out to me, and and it's not just with this particular condition, long COVID, okay? It's like they've seen a lot of different doctors, okay? And for those of you who I've already done a case for you with, you know what I'm talking about. They've seen a lot of doctors. They're looking for somebody to kind of fill in the gaps between these different doctors. They've had great medical care. By medical care definition, mean they've ruled out particular conditions. They've had medications to treat their conditions they have, but they're still looking for some function to come back, or they're not satisfied necessarily with their results. They've seen a bevy of other alternative medicine doctors that have provided them some relief temporarily, or maybe not. And they're just looking for answers. But some of these folks, they've been looking for a while, okay? And they have a long list of doctors in their wake. They have a long list of labs and a tremendous amount of medical expenses in the form of emergency room visits, specialized doctors, different types of therapies that aren't covered by insurance. And basically, they get to my office completely unable to function in life. They have other people that are doing the paperwork for them. They have almost no funds to afford me or any other practitioner. The insurance model that was supposed to help them did almost nothing for them. or nothing lasting. And basically, they are completely wiped out. They have no energy, and they don't have the emotional capacity or the grit needed to make the changes or the support network around them, because their relationships are completely gone. They're not able to work, so they can't make money. And they basically, there's nothing for them in the medical model at that point other than things to try to make them comfortable, or wait till they get so sick that they can get diagnosed with a condition like that can be treated by radiation or surgery or some sort of medication. They aren't getting a comprehensive enough intervention from other models to actually function. And they basically are lost, scared, depressed, in pain, and tired, and broke. And I work with some of them, and I can see the potential there, and I can see that they don't have what they need to get where they need to go. They just are out of gas. They might give up. They may drop off. They don't have the ability to follow along because it's a lot of information. And it's really, really, really tough to see that. But also, it's not about me. It's much tougher for them. But the reason I'm giving the seminar now is because this particular virus and the fallout from this virus will take a large percentage of you who are highly functioning and put you into that situation. There's a high probability of that, or a significant probability, let's say that. And I don't want this to happen to any of you, and especially for you. Part of the reason this seminar is private is because basically you and I are in a relationship together, and my goal in private practice is to form a relationship with you where I can be a resource. I want to keep in touch with you. I want to inform you about what this wave is coming. There is a tidal wave coming, and this is just the tip of it. And I want you to know that I am here for you, and I am up for the task. Okay. So with that, let's get into COVID. Now, there's a couple of things I want to share with you. So let's just talk about some definitions here. COVID-19, okay, and basically you get exposed to it about 2 weeks before you actually start getting symptoms, on average, 1 to 2 weeks. And basically, you're not going to get a PCR positive test in that first 2 weeks. And then you're going to start getting symptoms at about a weekend. Okay. Now, at that point, you're going to be PCR positive. Some people get symptoms like a week before they're PCR positive. You can see that here. But basically, the swab test or the blood testing, the PCR testing will come back negative for about a week, and then you start getting symptoms. Okay. Now, typically, the course of the virus, that's acute COVID-19, the course of the virus is about 4 weeks, and then it's gone. Okay. So from the 1 week period to 4 week period is acute COVID-19. And there's just a number of symptoms, and we're going to get into that here in a little bit. Okay. The next phase of COVID-19 is the subacute, or the ongoing phase. It's kind of like that acute inflammation happens. And then what happens is the fire still kind of rages for a little while, directly related to the virus. Okay. Of course, that's going to affect your energy levels, your motor system. It's going to affect your lungs. It's going to affect your brain. It's going to affect your heart, your blood vessels, your kidneys, and your skin, etc. Okay. And then what happens is about 12 weeks in is the next pivot point. Okay. And you're like, okay, so I'm still getting symptoms. I'm still getting fatigue. I'm still getting hair loss. I'm still getting depression. I'm still getting anxiety. I'm still dizzy. I still have vertigo. I'm still getting exercise-induced malaise. I still have like unexplained bleeding with my cycle. I'm still getting acid reflux, insomnia. I mean, come on, open a book and pick a symptom. There it is. Okay. Now, that could go on. And if it goes on and on and on and on and on, and you still have it in 6 months, and it started in the subacute phase or during the acute phase of COVID-19, that is the definition of chronic COVID-19, the so-called long hauler syndrome. Okay. So If you still have symptoms and you're 6 months out, you have long haul. If you had symptoms before, like say you had a concussion and your concussion symptoms are still there and they came back during COVID and they still have them 6 months later, you've reconcussed your brain from the inflammation. We're going to get a little bit into that later. You now have long haul. Some of you won't get long haul the first time you get the infection. Some of you won't get long haul from your first vaccine. Some of you will. Some of you already have. Some of you had these symptoms before you got COVID significantly, and now it's so much worse. I know, that's the reality. So that's kind of the definitions. Okay, let's talk about just a little bit of just a smidgen of research. This is a paper, excellent paper written by Dr. Yannick et al. Okay, I mentioned him earlier, and he describes the 4 phases of COVID. So here you are. Either you haven't had COVID, phase 1, you have COVID now, and you're in the escalating inflammation phase or the early part of COVID, okay? The next phase is you're starting to come out of COVID, and the last phase is you have a recovery. Prevention, which is the early part of COVID, meaning you haven't had it yet. That's me and my staff, not all of my staff. A lot of people I know haven't had it. Most people I know have had it. Then you get the infection. Then you go into this whole mess of physiology that we're going to get into a little bit later. And then you start to come out of it. That's the 3rd phase. And then the last phase is if you get stuck somewhere in that phase or later. Okay, so all of you are in one of those phases. Each one of these phases has a specific strategy that can be implemented. Now, some of you have gotten the infection, have gotten this paper from me, but let's just stop here for a second, okay? Let's just stop here for a second. I can't tell you how many times that we've gotten a call from somebody, Dr. Joe, hey, Michelle, I have COVID. What can I do? Look, there's a lot that goes into it, okay? I need to go back and look at your chart. I need to look at your last labs. I need to look at your last exam. I need to look at your most recent forms. I need to look at your progression of how things have been going. I need to talk to you about what your symptoms are, when you got the virus, how severe your symptoms are. Have you had any recent labs? I need to do all those things. I can't just say, take zinc, take glutathione. I can do those things, but it would be doing a massive disservice to you. But people are upset. They want a protocol. And I'm sorry, there isn't a protocol that I know that's available that will work for everybody. But I have developed a method called the Atlas method that I can help work through this. Okay, so just hang with me. Okay. Back to the research. Okay. If you want this paper, it's available. Ask Michelle, she can send it to you. If we get into some of the research, just quickly. Okay, let's get into this one. Sequelae in adults 6 months after COVID-19 infection, Journal of American Medicine. Okay, here we go. Now, again, this paper was shared with me by Sam Yannick, amazing doctor. Okay, a total of 177 of 234 participants. Okay, were basically that had COVID. Okay, this isn't a large number. Okay, but basically what they said here was that 6.2% of people that had COVID were asymptomatic in 6 months. 84.7% had mild illness, okay? 9% of these people had severe illness, okay? That's kind of the breakdown of who had it. So most of the people had mild illness, some had severe illness, and some had no symptoms, okay? Hypertension was the most common issue, okay? But basically what we have here is we have among participants with COVID-19, persistent symptoms were reported by 17 of 64 patients aged 18 to 34. 26% of people 18 to 39, excuse me. 26%, a quarter of people have symptoms that persist. That young, okay? 40 to 64, 30%, almost a third, basically a little over a third. And then people that were over the age of 65, 43%, almost half. Have long COVID. This is not a small number. That is the percentage of people that might find themselves talking on the phone with me in 6 months or maybe less, completely out of money, out of work, and out of relationships. Okay. 6-month neurological and psychiatric outcomes of 236,000 379 survivors. Now, among 236,379 patients diagnosed with COVID-19, this is The Lancet, one of the best peer-reviewed journals of all time. The estimated incidence of neurological or psychiatric diagnosis 6 months was 33.62%. 1/3 of people will have neurological or psychiatric. 1/3 of 236,379 people will have anxiety or depression, most commonly anxiety for the first time. Okay, now look what else is on here. Psychotic disorder, dementia, intracranial hemorrhage, stroke. Why does a chiropractic neurologist have anything to do with this? Well, gosh, I see these conditions every day in my office. Parkinsonism. Okay, the most diagnostic criteria were common in patients with COVID-19 and those who had influenza. This is not just the flu, folks. Most diagnostic categories were more common in patients who had COVID-19 than the flu. This is not just the flu, but even if it was, how devastating would that be? Our study provides evidence for substantial neurological and psychiatric morbidity in the 6 months after COVID-19 infection. Risks were greatest, but not limited to patients who had severe COVID-19. Look, this is just having it one time. Most of us are going to get it more than once. Okay. That's a little bit of the research. That's just a little bit of the research. There is so much research in this, I can't even tell you. It would take me 3 full-time jobs to read all the research for this. That's just a little bit about it. Now, I drew this earlier. Now, look, my whole fantasy was to draw this with you guys, okay? But then the Apple Pencil is so sensitive that like it just looked like a big freaking mess, okay? So here's the deal. Here's the virus getting into your lungs and GI system. So basically what I'm fixing to do now, we've talked a little bit about the percentage of people that are going to end up with long haul. We've talked a little bit about what that looks like at the end of their rope. Now we're going to talk about the 6 physiological loops people get stuck in and how myself and colleagues that are working in a similar way are unwinding this knot. Okay. And then at the end of that, we're going to talk about, okay, it's almost like a person with COVID-19 walks into a bar, right? It's not really a joke, okay? But we try to find some humor about it. They walk into the standard medical model, they get this. They walk into alternative clinic, they get this. They go onto Google and they find this, okay? But what's actually happening and what can we actually do, okay? And why is it hitting people so hard? And are you a sitting duck right now? That's what I'm concerned about. Okay, COVID-19, this is an amazing story, okay? Virus gets into the lungs and the GI. Now, on the way to the lungs and the GI, it gets into the mouth. And when it gets in the mouth and it gets in the nose, it starts wreaking havoc immediately. And what happens? Loss of sense of taste, lots of sense of smell. No big deal. Hang on a second. No big deal. Nerve damage, nerve inflammation to your sense of smell and to your sense of taste. Sense of smell projects directly to the prefrontal area of your brain. Sense of taste projects directly to the area that regulates your autonomic nervous system. If that area is inflamed, that is a huge, huge, huge deal. Okay, what does a chiropractic neurologist have to do with this? I've been studying the brain. I've been like, this is like the worthy adversary here. We can totally sort through this. All right, now, you get all these chemicals released. Okay, by the way, if it gets in the lungs, shortness of breath, coughing, if it gets in the GI, a lot of people don't have lung symptoms. They just like, swallow air when they talk. They swallow air when they eat, gets in their GI system, and it starts wreaking havoc there. So they get like stomach pain and they get diarrhea, they get acid reflux. That's their big expression initially, besides the lung issue and the loss of smell and the loss of taste. Okay, here's a bunch of chemicals being secreted. Okay, that's the green stuff here. They go over here and they tell a mast cell to release histamine. So we're going to go into that little diagram next. But then it also goes down here, and think of the blue on here as different types of white blood cells. Okay, think of the orange on here as different tissues. Think of the brown on here as different infections. Think of the red as some of the worst brain stuff that's going on. Think of the green as chemicals that are being released. Okay, and think of the purple as some of the nastiest crap that you can imagine that would happen. Okay. So let's just go down this little tree for a second, okay? And also black arrows means that they're activating, red arrows means that they're suppressing, okay? So here we go. COVID gets into your lungs, it gets into your GI system, you release these different chemicals, TSLP, interleukin-13. Makes sense, right? You're gonna start attracting a bunch of stuff. You basically have to say this, I imagine like a army barracks sleeping soundly, and then the red light goes off, the alarm goes off, and now you have people running to their helicopters, you have people running to get their weapons, they're putting their boots on, there's Army, there's Navy, there's Air Force, there's Marines, there's SEAL Team 6, there's all these different incredible types of white blood cells in your body, and I just don't have time to get into the details of all of these, okay, but let it be known they're involved, obviously, and that's all I'm saying, okay? This Th2 is a type of white blood cell. Okay, what's nasty about this guy, the way this guy helps is it's almost like if you remember Desert Storm, and maybe those of you don't remember Desert Storm because you're not an old guy like me, but basically there's these things called smart bombs, and the bombs are what blow things up, but there's somebody with a laser on a target, and the laser points to it and the bomb goes to it. Think of the Th2 cells as directing other cells to the area to take care of it. That's their main job. Okay, so of course you're going to have a ton of Th2 directing white blood cells to the area. Okay, the problem is it also stimulates mast cells. The mast cells are just going to dump histamine. Okay, this is why you're tired but can't sleep. This is why you're getting diarrhea and muscle cramping. Okay, this is why your skin is itching. Okay, but basically the histamine goes over to the brain. It causes brain fog. It goes to the brain, it causes insomnia and anxiety. Okay. Can I just talk about anxiety for a second? Okay. If we go back to that neuropsychiatric paper about people that are getting anxiety for the first time, here's what's happening to them. They're just being told, just get over it. It's in your mind. Of course, there's some anxiety about going in the hospital. Yes. Okay. But they're basically being told to get over it. There's a biological reason they have anxiety. There's a biological reason you're having panic attacks. There's a biological reason you can't sleep at night and your heart is racing. It's not in your mind. For most of you who've had COVID, it's a biological, physiological process that we can identify. And once we nail it down, we can start working with it. Okay, so you get brain symptoms, heart symptoms, GI symptoms, and skin symptoms. That's itchy skin, that's red skin. You're going to get loose stool diarrhea, maybe diarrhea with constipation. You're going to start getting more new food sensitivities. Now, this brain issue causes your sensory neurons to just light up. Just imagine, like, if you guys have seen that Bodies exhibit where they show all the fascia, like with the muscle removed, right? Or you've seen those like diagrams of like the fiber optic cable of the nervous system, how it goes to every single tissue in the body. Imagine all of my muscle and blood and everything just stripped away, but only the fiber optic cable of my nervous system. Imagine that for a second. Now imagine the brain has a bunch of histamine dumped in it and it goes offline. Those neurons, all those fiber optic neurons now release 3 substances. Those substances cause migraine. They cause pain. Everything hurts. Now, does it hurt a little bit or a lot for you? And guess what? Maybe it's not your whole body. Maybe it's just that old knee injury. Maybe it's your neck is starting to hurt. Okay. Then it tells your bone marrow to start making these guys, ILC2s. We're going to come back to that. Okay. That's a whole nother ball of wax. That is a disaster. Okay. Now listen, you need this, but what happens is these loops don't stop. And when these loops don't stop, that's when the bad things start happening, because that's when you get into long COVID. So this entire process should happen, and then it should calm down. But if it doesn't calm down, these are the loops that you get stuck with. Okay, I got to start talking faster. Here we go. Sensory neurons cause all those symptoms. Okay, that's called neurogenic inflammation. That means that the brain is now offline. If the brain is offline, then you're going to have what looks like mast cell activation syndrome. And by the way, it's both. So now the mast cells activate histamine and all these symptoms, but then the sensory neurons also go to the mast cell and tell the mast cell to dump histamine. That's called a vicious cycle. Can you see how nasty this is getting? Now, the brain issues are basically, in addition to anxiety and depression, we have POTS, postural orthostatic tachycardia syndrome. Basically, you stand up, you feel like you're going to pass out. You stand up, the lights start going dark. You stand up, your heart starts racing. But guess what? It's not just when you stand up. It's also when you have a perception of threat or stress. Even if it's not an actual stress, just the perception of stress can cause that, okay? It leads to myalgic encephalomyelitis, all about me, okay? Producer Chesley, who's been helping us here, she's got a whole documentary she's making on this, okay? And listen, ME, these are the people I'm talking about. They've done everything that they could possibly do, and they're basically broke, depressed, they can't function. And there's just this wave of myalgic encephalomyelitis that's just waiting. It's like a freaking tidal wave. It's coming, okay? But we can push this back if we all get together. If you demand this from your doctors, you support myself and colleagues of mine that are doing this work, we've shown that it can work. We can start creating a sea change going the other way, and we can start getting funding for this stuff. And the insurance model isn't going to bail us out. We're going to need funding to help people that need it, but we have to show that it works. Okay. Brain fog. Brain fog is basically like this. I can't think straight. Okay. But then the brain fog, the POTS, and the myalgic encephalomyelitis, which is sleep, I hurt to move, and I'm super tired, basically causes the histamine release again. So now that's another vicious loop. Okay. Now, the migraine down here causes vascular changes. Sorry, I'm starting to yell. The migraine, should I go smooth? The migraine causes vascular changes. The vascular changes now causes POTS, myalgic encephalomyelitis, and brain fog. And now that change in the brain leads to central nervous system inflammation, okay? Central nervous system inflammation. That looks like depression. That looks like anxiety. And then now another big factor here is stress chemistry. Stress chemistry is weight gain around the middle, acid reflux, anxiety, high blood pressure, irritable bowel syndrome, constipation, osteoporosis if it's prolonged, basically a cardiovascular disease if it's prolonged, and cancer if it's prolonged. And why is all that happening? Well, the Th2 system goes up. I should have an up arrow here. The interleukin, the ILC2 goes up, but then these guys down here, Th1 cells, natural killer cells, and cytotoxic T cells, they go down. Well, that's what kills cancer. And that's what kills existing infections in your body. And we're going to get into that loop later, okay? But basically, stress chemistry, some of you are just totally stuck in brain inflammation. The people that are getting whacked the hardest by this, got whacked the hardest with the vaccines, got whacked the hardest with this particular infection are people that have had concussions, people that have PTSD, people that have had permanent plastic changes to the immune cells in their brain called glial cells. A good indication that you have a glial cell issue is if alcohol, lack of sleep, exercising too hard or being sedentary, certain foods, or stress wipe you out. Okay, if those things are happening, there's a good chance that you have neuroinflammation. So that neuroinflammation further suppresses brain function, which further exacerbates neurogenic inflammation. That neurogenic inflammation causes a mast cell issue through histamine, which activates Th2 cells, which then suppresses Th1 cells and natural killer cells, which leaves you more vulnerable to like your Epstein-Barr virus, cancer, mold down here. Lyme, there's your flaring of Lyme. There's your strep throat that won't go away now. There's your Epstein-Barr virus. All these people right now that are getting all these herpes viruses are coming back on them. Like, geez, I started to get dizzy. I was getting panic attacks. And then like I go work out and suddenly I have herpes again. And I haven't had that for years. And I can't seem to control with my medicine anymore. Like these are the stories that I'm hearing. Okay. So that's another loop. Okay. Then the next loop, it's so nasty. Okay, so you get these vascular changes, okay? And then you get these interleukin ILC2 cells, okay? They activate something called myeloid-derived suppressor cells in the bone marrow. So this is that bone marrow activation I was talking about. And MDSCs elevate something called TGF-beta. Most of you have been working with me this year. I keep ordering this test. TGF-beta goes up. TGF-beta goes up. That's more free radicals. That's what's aging you. That's what's making you tired. That's depleting you of glutathione. Depletion of glutathione, you lose support for your natural killer cells and cytotoxic T cells, and you lose barrier support in your lungs, your GI, and your brain. So now you have a leaky brain, a leaky gut, and leaky lungs. So whatever's going on, that battle that's holding everything at bay, keeping it out of your bloodstream, now it's getting into your bloodstream and it's becoming systemic because glutathione's going down. Like, how many of you have I asked to, have you been taking your glutathione? Are you taking your glutathione recycling? Now, quick aside, vitamin D, vitamin A, some fish oils, and N-acetylcysteine can increase TGF-beta. Okay, so if I've given you vitamin D and vitamin A in the past, and it's not working for you anymore, or you're taking a product like trisomal glutathione with NAC in it, you might need to stop it right now. If you haven't talked to me in 6 months and you're reacting to your glutathione and you just think I'm a wanker because I gave you a supplement that now you react to, you know, maybe I am a wanker, okay? But maybe it's because you're taking something that worked for you 6 months ago and it's not working for you right now. So we got to swap you out of anything with NAC in it. If you read the news, what are they saying? Take vitamin D and take N-acetylcysteine. In fact, N-acetylcysteine might be something they take off the market because it's so good at treating specific viral infections. Well, guess what? If you're in one of these loops, like up here, or maybe down here, but this loop is not activated, NAC could be amazing for you. But if you have high TGF-beta, NAC could be a major problem for you. So just keep that in mind. Here's what happens. TGF-beta goes up. You start fibrosing. Look, TGF-beta is supposed to go up to calm down this freaking mess. TGF-beta suppresses all of the different types of white blood cells. Okay? It's supposed to do that. You're supposed to come out of this mess. But if you already have fibrotic tissue, if you already have high TGF-beta and you get pushed into this loop, you end up with fibrosis. By the way, you're going to get fibrosis the first time you get COVID. You're going to get fibrosis from going to bed tonight and waking up tomorrow. Our body is constantly going fibrosis, which is basically permanent scarring and permanent loss of function. So let me just tell you one quick story before I come back to that loop, okay? Here's what's supposed to happen. You get the virus, it goes like this, and then you have an inflammatory response that exceeds the virus, okay? And then you have resolution chemistry that's supposed to stop the inflammation, and then everything comes down. That's a hunky-dory story. That's perfect. That's like resiliency. That's immune resiliency. So then you got sick, you had symptoms, or maybe you didn't, and you came out of it. That's like 2/3 to 1/3 to 1/2 of people right now, the first time they get COVID or the first vaccine they get. Let's talk about another story. Okay, that's the ideal thing. Wouldn't that be great if that was all of you? Okay, for some of you, that's what it is the first time you get it. The second story is there it goes. Okay, you get the virus, then you get inflammation, and the inflammation doesn't come down because your resolution chemistry sucks. Okay, so that looks like your autoimmunity is worse. You feel like crap. Your sense of smell is back. Your sense of taste is back. You don't have lung symptoms anymore, but you can't function anymore. And you're just like going downhill. That has a different type of history and a different type of labs and a different type of exam. I don't have time to get into all those exam findings, but if you want me to go through it later, I absolutely will. You just got to let Michelle know what you want, and I'll put it together. Okay. The third type, virus comes in, inflammation chemistry insufficient, and you end up getting stuck where these viruses start to bloom out. So COVID will go away, but your Epstein-Barr virus, your herpes virus, your chickenpox virus comes back with a vengeance. Your mold comes back, your Lyme comes back, and now you're stuck in resolution chemistry. That's like high TGF-beta, basically. And now you have all these other infections going on, and you can't resolve the infections. And now you're inflamed, and you have high viral loads. That sucks too. Let's go back to the normal story real quick. Normal story. Inflammation happens. Sorry, it's the same color, but this is inflammation. Then resolution happens. Let's go resolution, a different color. Okay, resolution happens. And then you start to come out of resolution. And this is actually more accurate. So about 3 weeks to about 6 weeks, that happens. Now, here you are. You're going into resolution. Are you pattern number 1? Are you pattern number 2 or pattern number 3? Well, guess what? At 3 weeks, you have no idea. You have no idea at 3 weeks. Okay, but what about at 6 weeks? Kind of hanging around. Okay, while you're down here in resolution, you're undergoing fibrotic changes. You're undergoing permanent loss of function. I'm not saying that to put that in your face. I'm just being real with you. This is called aging. Okay, I just took an amazing aging seminar with Dr. Tatis Karazian over the weekend, and we basically talked about geroscience, which is studying how people age. Okay, and like, look, there's consequences to this stuff. And the consequences are, if your telomeres shorten to a certain point, your cells can't divide anymore. If your DNA gets fragmented to the point it can't function, your telomeres shorten. Okay, if these things start happening and they're chronic and they last long enough, where you jump in on this story and where we start doing it will determine how much function we can get back. Not everybody will respond the same way. That's why protocols don't work. Process can be helpful, but not everybody has the same capacity. Some of you haven't got the virus yet, but you're in like pattern number 3 where you already have high TGF-beta. We have to get that down before you get COVID. You're in pattern number 2 where you have high CRP, high neutrophils, and you get COVID. You're going to have more tissue damage, more vascular damage. You're going to have more brain damage. You're going to have more cardiovascular damage. And then you're going to have more need for resolution, and you're going to have more scarring, more loss of function. So like, what do you want from your doctor right now? Because most people want crisis management. I totally get that. And I want to help you with your crisis. Okay. But what I want to do is help you stay out of the emergency room, because right now, emergency room doctors are just like, look, you're not dying. You're not having a clot that's going to kill you. They're running the scans. Like, you're spending your down payment, you're spending all this money on ER visits, and they're not doing much for you. They'll tell you, like, they're making sure you're not dying, which is a valuable service. But apart from that, what are they doing? Okay, your deductible is being met, but like, how many thousands of dollars do you want to spend on your deductible? When you start talking about dementia and Parkinsonian and like loss of like vascular supply, which is silent stroke, how many years do you want to preserve your brain so that you're not in a nursing home at about, 100, what is it, 100K a year for nursing homes right now, $12,000 a month in California for a nursing home? How many years do you want to save? Like, that's another service that I can provide for you. We can't prove prevention. Okay. But gosh, we can understand these loops. We can understand these loops. I didn't even get through all the loops yet. Here's the permanent scarring loop. Okay. Now, NET stands for neutrophil. That's what's causing the vascular damage. So you get free radicals, which is what making you tired, which is making you feel like you're aging. You look at people that you haven't seen in a few years and you're like, oh my gosh. You almost don't recognize some of them. Okay. What's going on? They're aging. Their glutathione is dropping. Their barriers are going down. They're polarizing their immune responses. And then when their immune system goes down, all these infections come back. Now, what's the best way to new autoimmunity? Infectious disease. It's the fastest way to new autoimmunity. Okay. But is this virus like other virus? Is it like the flu? Is it like the cold? No, it's not. What's freaking freaky about this particular virus? This is a paper written by Dr. Aristo Vijdani and Dr. Karazian, who I mentioned earlier. Check this out. Where is it? Is it this one? Reaction of human monoclonal antibodies to SARS COVID proteins. It's not COVID-19, it's COVID-2. Okay, but still, COVID virus. Okay. This extensive immune cross-reactivity between SARS-CoV-2 antibodies and different antigen groups may play a role in multi-system disease process. This is why so many people have so many symptoms, and the influence It influences the severity of the disease. It may precipitate the onset of autoimmunity, in susceptible subgroups and potentially exacerbate autoimmunity in subjects that have pre-existing autoimmune diseases. The cold isn't doing that. The flu isn't doing that the same way. Okay, back to this diagram, and then I'll take questions. Okay, this neutrophil activation, which looks like high neutrophils on your labs, CBC with differentials, $5. It basically, this is where the microvascular issues come from. These nets are set up to catch the viruses. These nets are set up to catch COVID. Okay, but it chokes off blood supply, which increases inflammation, which makes central nervous system inflammation worse. So if you have concussion or PTSD, or you were like me and was dropped on his head when you were a kid, then you know what? I haven't gotten COVID yet, but I can expect some symptoms from that are maybe more than the standard person. Okay. Now, this lack of oxygen and the lack of inflammation will make people that are susceptible to autoimmunity be more likely to get new autoimmunity. That inflammation will come up here and drive up the midbrain. This looks like anxiety, insomnia, rapid heart rate. It looks like sweaty hands, sweaty feet, weird sweating stuff. It looks like heart rate that just feels like it's beating out of your chest. Okay, that's what that neurological thing is. On your VNG that we run, this looks very obvious. On your exam, your neuro exam, this looks very obvious. It's like dilated pupils, high blood pressure, maybe more on one side than the other, angulation of limbs causing things like sore knees, sore elbows, sore wrists. Okay, then that also activates the NET, which is the neutrophil, which then activates Th17 cells. By the way, so does the lung GI. There should be a direct arrow from Th17 and direct arrow from Th2 activates Th17. This is the cell that actually kills the freaking virus in the hollow space. We need it. Okay, but did you know that Th17 cells also are what trigger autoimmunity? I'm sorry, they don't trigger it. They actually carry out the death of living healthy tissue in autoimmunity. Autoimmunity isn't the cleaning up of damaged tissue. It is like your immune system's like, oh, see that piece of heart tissue? I'm sorry, I must think that is a threat. So I'm going to start chewing up living heart tissue. I'm going to start chewing up living brain tissue. That's what a Th17 cell can do when it's misguided. One of the ways it can be misguided and some of the tissues that it can start being confused with because of this virus. Let's take a look. Let's take a look at spike protein. Well, it can look like mitochondria, which make energy. Okay, it can look like GAD65, which would give you anxiety and diabetes. Maybe you've heard on the news how this virus is causing diabetes. It can cause phospholipid antibodies, which causes stroke. It causes lupus. Okay, it can cause occludin-zonulin, which is leaky gut. Spike protein, obviously, we know that it reacts with itself. Okay, I mean this is DNA, not so much there, but look at this actin. That's smooth muscle. This is your DNA, these two right here. This is your blood-brain barrier. Anything above the red line is fair game. Okay, so we activate those Th17 cells. What if you already have Th17 cells that want to kill healthy tissue? Autoimmune flare. Okay, so what are the loops? The original loop is what your body's supposed to do. Okay, the second loop is basically neurogenic inflammation. The third loop is neuroinflammation. The fourth loop is permanent loss of function and aging. The fifth loop is blooming out of your old infections and new autoimmunity. And the sixth loop is autoimmune flare, worsening of your existing autoimmunity, and then basically wind up of your sympathetic nervous system, which then the arrow could also go from here all the way down to here. There's just not enough room on this to make all the arrows. Okay, so those are the 6 loops. This person walks into a medical doctor's office. Right now, they're being told, you're just getting older. That's the #1 statement. Well, maybe you are getting older. Yes, you're getting older. Okay, can you do something about it? Well, there's no drug that can actively do something about all of this, okay? But there are drugs that can help with histamine. There are drugs that can help with depression. There are drugs that can help with anxiety. There are drugs that can help with migraine. There are drugs that can help with acid reflux. There's drugs that can help with all these symptoms, but most of these drugs are not breaking these loops. That same person walks into my office when I was an intern doing only chiropractic, and they get a chiropractic adjustment that might help them with pain. That's honorable work. Okay, is it breaking these loops? No. If they go to another alternative medicine doctor who might do whatever they're good at, they're one or two things they're good at, maybe a gut program. Is that going to help them? It might. Okay, but is it going to break these loops? It might. Okay, my question for you is, which of these loops are going for you? How many infections do you have right now? And is it a little bit of tissue or is it a lot of tissue? Is it a mild infection? Is it severe? Is it 5 infections? Is it 15 infections? Do you see how hard this can be on my end? It's not as simple as me saying, take glutathione. Although most of you would probably benefit from finding your dose of glutathione. The sad person is the person that can't tolerate glutathione. Okay. I just got off the phone this week, a quick story, and then I'll take questions. By the way, I can do another seminar just looking at labs and going through that with you shorter. I can look at just one of these loops and go through it shorter with you. Okay. I can look at just the neurology of this and just POTS and spend days on this. We can do whatever you want. I am an instrument. You can play hot cross buns or we can play a concerto. What do you want to play? How do you want to use me? I'm here for you. Okay. I'm also managing a lot of you, and Michelle and I and Jess are managing a lot of you. Be patient with us. Okay. Sometimes we get 15 questions in a row, 15 emails. Okay. While we're managing other clients, just bear with us. Okay. We'll get back to you. I'm going to say, I don't know sometimes, and sometimes I need to talk to you. It's because I actually really need to talk to you. It's not because I'm going after your wallet. Okay. I'm actually trying to save you a ton of money on ER visits and save you dementia and save you nursing home time. Okay. All right. A colleague of mine called me this week, 41 years old, is in healthcare, has had COVID 3 times. You know why? She's in healthcare. She's exposed to it every day. First time, no big deal. Second time, kind of bad. Third time, she is at Costco and loses continence. She goes to her colleagues, and one of her colleagues says, you know, you're just getting older. You're not getting older. You're not just getting older. Your accelerated aging and fibrotic changes, some of which may never come back. You don't know at 3 weeks if you're going to be talking to me in 12 weeks or in 6 months. So what I'm trying to say, and the reason you might hear pressure in my speech, is because I don't want to lose any of you to this loss of function. And I don't know everything, but I know a lot about this. And I want to jump in and I want to help you. Okay. We started a private Facebook page. We can't add any of you to that Facebook page for HIPAA reasons. However, if you go to Facebook and go to Atlas Health and you would like to be added to the private page, I want a support group where you guys can ask each other questions and help each other a little bit too. And then I'll get on there from time to time, and so will Michelle,